All right, let's look at Jade in one last way. We're going to go through this case a little slower, a little bit deeper. We're going to basically start in the beginning and go to the end so that if you're really looking at this case, you can start to dive in and see exactly what we did. Starting with good bracket positioning, then moving through our wires slowly, beginning class 2 elastics, getting to the middle of treatment and ending phase 2 with some repositioning, and then really dialing in the end with finishing up her AP elastics and just making sure that the brackets are in the right spot. You'll see in Jade's case that it turned out beautifully. Again, there's always things that we can pick up, and it's always we're learning as we go. And when we go into the course and we go through this case in a really, really deep dive, we'll go through all of the learning lessons from this case and what we have done to improve our outcomes as we've learned more about the Damon Ultima system over the last 3 years. Thanks a lot. Bye-bye. All right, let's go ahead and look at Jade one last time, but we're going to do this in a little bit of a longer format, okay? Jade was treated in 18 months, and she was a pretty common class 2 case that we see in our practice. Not full step class 2, but about 50 to 60% with some increased overjet and overbite. When we really look at this, we break this down into aesthetic diagnosis. We'll go through some variable torque selections and just go ahead and where we place the brackets. So when we look at our initial records, we see a typical class 2, right? The upper arch is a little bit constricted, the molars are rotated, the lower arch is a little bit constricted, and we just have an overall, slight class 2 in the molars, about 50, 60% in the canines. X-rays really don't show anything significant, just delayed eruption of the 7s, which we know. And then from an X-ray standpoint, again, it just verifies that she has some class 2 components to it that we have to make sure that we treat out. Now, from a variable torque selection, we know that we're going to be running a decent amount of class 2 mechanics. We also know that we're going to have a lot of buccal development. So we want to protect the angulation of central incisors. Now, at this time, I was using some neutral torque brackets. I don't use them anymore. What I would choose now is all procline on the upper, procline on the lower 3s, and retrocline on the lower 2 to 2. Now, the reason for that is, again, I want to make sure that I protect the angulation. And as long as I'm using light forces and light class 2 mechanics, there's a really great couple that occurs at the end with the 18/0275 that's going to make sure that we don't have any retroclination or quote dumping of the upper incisors in an expansion/class 2 case. So overall treatment time for her was about 18 months from start to finish, which for a class 2 case with a beautiful outcome is pretty respectable. Again, we spent a little bit of time trying to make sure her CRCO slide was on point. Let's go through her treatment. So initially what we did was we put her braces on in phase 1, went through an 0-4 for 8 weeks, 0-8 copper nine tie upper and lower. We started her class 2 elastics, very light, 2-ounce elastics from the upper 4s to the lower 6s, and then went ahead to her 14/0275 copper nine tie and left those in for a couple visits because we wanted to make sure that we were getting some really good class 2 correction. Overall, phase 1 took about 8 months. And if you really look at what we were able to achieve, we were able to wait for 7s, able to bond those. I think that getting control of your upper and lower 7s is critical in a class 2 case because without the lower 7, almost impossible to level the arch completely, which means you're not going to be able to get a good AP correction. But you can see we just are coming out of phase 1, so I don't expect the overbite and overjet to be fully corrected yet. That takes a little bit of time. But I do expect for the rotations and all of the first order to be resolved. So going into phase 2, we take out our 14/0275s, we put in the 18/0275, we continue our class 2 elastics, bump them up to 3.5 ounces, which is a rabbit. In the middle, we reposition, and then at the end of 12 weeks, here's how it looks. You can see the overbite is correcting, the overjet is correcting. We have a little bit more arch development, some space in the upper. This is exactly what we want to see. Overall, the torque is looking really nice. So now I just know to finish this case, we just have to develop the upper arch, close the space, and just finish up the CRCO slide with the AP. So we go ahead and we put in some steel wires, 18/0275 in the upper, 16/0275 in the lower. We continue the class 2 elastics, but now we're using the posted arch wires instead of the teeth. And here's how phase 3 looks. Now remember, phase 3 is a week before debond. We're just making sure everything looks good, testing everything out, looking for contact, breaks, or any sort of enamel recontouring. All in all, she looks really great. And we're able to finish this case up pretty efficiently. Now, when we really look at the overall sequence, the sequence was pretty traditional to what we see with Damon Ultima. A round wire phase followed by a full expression rectangular phase, some AP elastics, just making sure everything's dialed in. X-rays look really good. When we go a little bit of before and after, you can see that really just good bracket positioning. We didn't have to put the brackets anywhere else other than they belonged, right? Right at 5.5 millimeters from the incisal edge to the bracket slot, which is FA point for the central incisors, 5 on the lateral and 5 on the canine. Ended up yielding some really great results. You can see the buccal occlusion looks nice. Both sides, everything's really socked in. Really nice upper arch development. Again, not over expansion. This is natural arch form. We just went from the patient's current arch form to natural arch form. And you can see in the lower, really nice buccal uprighting. Nothing that's overexpanded. Really, we have the teeth over the wall of ridge, which basically is what Larry Andrews describes as being ideal for periodontal axial support, and really retained it nicely with a fixed retainer. Progressive arch development is really where we see this case shining with traditional PSL. You go from beginning to end, and it just looks quite nice. From the facial aspect, this is where we see the smiles develop, right? In phase 1 and phase 2, we really got a really nice bump of transverse development. Phase 3, dialed things in. And really, we just look, and this patient's smile fits her face nicely. She's happy, she's excited, overjet's taken care of. From a mini aesthetic standpoint, we're dialed in. And again, when you have a full expression 3D system, you're not having to use all these auxiliaries to get the teeth in the proper position. Again, a highlight is that phase 3 doesn't require any bends in the wire, so really the appliance is giving us what we need. If you really like this case, you can check it out, and we go into really a lot of detail in our course, but hopefully you enjoyed that, and look forward to showing you the next case. Bye-bye.